Children's Sudafed is used for the temporary relief of stuffy nose and sinus pain/pressure caused by infection or other breathing illnesses such as hay fever, allergies, and bronchitis. It works by narrowing the blood vessels to decrease swelling and congestion. If you are self-treating with this medication, it is important to read the manufacturer's package instructions carefully so you know when to consult your doctor or pharmacist. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product in children younger than 6 years unless specifically directed by the doctor. Long-acting tablets/capsules are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar decongestants. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms such as drinking enough fluids, using a humidifier or saline nose drop/spray. When taking children's Sudafed, it's important to follow the directions on the product package or as directed by your doctor. The usual dosage is every 4 to 6 hours, but do not take more than 4 doses in a day. The dosage is based on age, medical condition, and response to treatment. It's important not to increase the dose or take it more often than directed. If you are using the chewable tablets, chew each tablet well and swallow. If you are using the liquid form, measure the dose carefully using a special measuring device/cup. Do not use a household spoon because you may not get the correct dose. Some tablets should be swallowed with plenty of water, so check the product package for specific directions. It's important to read the dosing instructions carefully for each product because the amount of pseudoephedrine may be different between products. Do not take more pseudoephedrine than recommended. It's important to note that caffeine can increase the side effects of this medication. Avoid drinking large amounts of beverages containing caffeine, eating large amounts of chocolate, or taking non-prescription products that contain caffeine. If your symptoms do not improve after 7 days, worsen or return, or if you develop a headache that doesn't go away, fever, or rash, it's important to seek medical help right away. Some common side effects of children's Sudafed may include nausea, vomiting, trouble sleeping, dizziness, headache, or nervousness. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. However, many people using this medication do not experience serious side effects. It's important to stop taking children's Sudafed and contact your doctor immediately if you experience fast/irregular/pounding heartbeat, mental/mood changes, such as anxiety, confusion, restlessness, shaking, tremor, or difficulty urinating. Although rare, a serious allergic reaction to children's Sudafed may occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before giving children's Sudafed to your child, it's important to talk to your doctor or pharmacist if your child has any allergies, or has had negative reactions to other similar medications. If your child has certain health conditions such as diabetes, glaucoma, heart problems, high blood pressure, kidney disease, overactive thyroid, or difficulty urinating, it's important to consult a doctor or pharmacist before using this medication. Children's Sudafed may cause dizziness, and alcohol or marijuana can make it worse. It's important to avoid activities that require alertness, and limit alcoholic beverages. If your child uses marijuana, it's important to talk to a doctor. Some forms of children's Sudafed may contain sugar and/or aspartame, and liquid forms may also contain alcohol. If your child has diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires dietary restrictions, it's important to ask a doctor or pharmacist about using this product safely. If your child is going to have surgery, it's important to inform the doctor or dentist about all the medications they are using, including children's Sudafed. Children and older adults may be more sensitive to the effects of this medication, and it's important to be aware of potential side effects. If your child is pregnant or breastfeeding, it's important to discuss the risks and benefits of using children's Sudafed with a doctor. It's important to be aware of any potential drug interactions that may occur when taking children's Sudafed. This includes the risk of serious side effects or changes in how your medications work. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Avoid taking MAO inhibitors with children's Sudafed, as it may cause a serious and possibly fatal drug interaction. This includes medications such as isocarboxazid, linezolid, phenelzine, and selegiline. It's important to talk to your doctor about when to start or stop taking these medications. Additionally, it's important to check the labels on all your medicines, especially allergy or cough and cold products, as they may contain similar ingredients to children's Sudafed, such as decongestants. Always ask your pharmacist about using these products safely. And always remember to follow the recommended daily dosage and the optimal timing for taking this medication. If someone has taken too much children's Sudafed and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, hallucinations, and seizures. This medicine should only be used for a short time. Don't use it for more than a week without talking to your doctor first. If a dose of children's Sudafed is missed, it should be taken as soon as remembered. If it is close to the time for the next dose, the missed dose should be skipped. It is important not to take a double dose to make up for the missed one. When it comes to storing children's Sudafed, it's important to follow the instructions on the product package or ask your pharmacist for guidance. You should always keep all medications out of reach of children and pets to ensure their safety. It's crucial not to flush children's Sudafed down the toilet or pour it into a drain unless specifically instructed to do so. When the medication expires or is no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to discard children's Sudafed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.